Good morning. Welcome to today's media conference to update you on government's efforts to combat COVID-19. I have with me this morning the Minister of Health, the Honorable Terence Dayal Singh, the Minister of National Security, the Honorable Stuart Young, and Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health. But before we get started, as we promised, the government is working on a virtual solution to these face-to-face media conferences. In fact, we will be testing our system with you today, the media, at 1:30 p.m. Do know we are committed and are making every effort to keep everyone safe as we keep the lines of communication open for you, the media, in this time of COVID-19. And we will now start with the Minister of Health.
Thank you very much, Minister Cox, my cabinet colleague, Minister Stuart Young, Minister of National Security, Chief Medical Officer, ladies and gentlemen of the media, and our dear citizens of Trinidad and Tobago. As you know, and it is worth repeating, Trinidad and Tobago is one of over 150 countries around the world that is part of this global pandemic called COVID-19. The global figures, as you know, are quite alarming. They are quite frightening, and countries around the world are doing the best that they can to mitigate risk and to protect their citizens. As part of our regular updates, I would like to inform the population of the following. The number of samples submitted to CARPHA for testing as of March 27, 2020, is 453. Number of samples which have tested positive, 66. It must be noted, out of that 66, 47 came from one source, which unfortunately was that cruise ship, and the passengers came in here in two batches, an initial small batch of about 3 or 4 people, and then the 68 people who were then quarantined at Balandra. So 47 of the 66 came from one source, which means out of that we have 19 cases. I give you this statistic not to blame anything or blame anybody, but the fact is that should give us some degree of comfort in that our risk of community spread is lower coming out of those 19 cases versus the entire 66 cases. The contact tracing for all those 19 cases are very well underway, primary contacts especially, and secondary contacts. Number of persons discharged. Yes, we have had one discharge, is 1. We will not be identifying which one, whether it's patient number 2, 3, 4, or 5, because of patient confidentiality. But the public ought to know, and the media ought to be informed, that to date, 1 person has been discharged. In our daily updates moving forward from now on, 10 a.m. and 4 p.m., we'll be adding another statistical line, which is the number of deaths. We now have 2 deaths from COVID-19. The second person is a national of Trinidad and Tobago who tested positive, was an elderly gentleman, unfortunately, with pre-existing medical complications. We followed the process as identified by the Chief Medical Officer before we make a death public. That is, we wait for a reasonable time for the family to be informed, for the family to bring in all their documents so that the death certificate and so on can be processed. But more importantly, we must give the family enough time to process and grieve before this becomes a public issue. I must remind the public that this is not an impersonal issue. This is not person number 3, person number 4. These unfortunate people who have died, to their families and friends, they are real-life people, flesh and blood. They could be a father, an uncle, a brother. So we at the ministry have taken a very moral, ethical stance in the way we treat with the dissemination of information regarding the deaths of any COVID-19 patient. We will give it to the media in our either 10 a.m. or 4 p.m. updates as they occur. We will not be sending out a separate media announcement. And this is out of deference to the families and their feelings at their times of grief. So that is the current update. The Chief Medical Officer would have mentioned at one of the earlier press briefings that Trinidad and Tobago has reached a tipping point. And let me explain as Minister of Health what we are doing, what that tipping point means. We would have closed our borders on the 22nd of March, I believe, or the 25th of March, last week, Sunday. Prior to that, approximately 19,852 travelers, residents, citizens made their way into Trinidad and Tobago. That is where the tipping point is, because the vast majority of these 19,852 would have come from 3 major countries, the United Kingdom, Canada, and the United States. And we see what is happening in the United Kingdom and the United States especially. We are now on the cusp, if we do not manage this issue very carefully, and if we don't get the cooperation of these 19,852 people to stay at home and self-quarantine, the following could unfold. The Chief Medical Officer will go into more detail, but as we know, symptoms generally appear between 7 to 8 days after exposure. So these 19,852 who would have beat the deadline of midnight last week, Sunday, we are now in that period, coming into that period where it is most critical for them to self-isolate. Self-isolate, as the Prime Minister said yesterday, SIQ, stay at home, isolate, quarantine. However, we know some persons do not heed these warnings, and I would like to refer you to an article in one of today's newspapers, about what is happening in Guyana. You are seeing where people are not behaving responsibly. But we have to respond. The healthcare system has to respond. How are we responding? We have built out and continue to build out primary, basic, secondary, and tertiary care facilities in case we get this exponential rise in cases, which we expect will start to hit from this weekend, 7 to 8 days after our borders were closed. For our primary or basic care, these are for people with very mild symptoms who do not need to be in a hospital, who just need supportive care, paracetamol, some water, but need to be isolated with basic care in isolation. We have ramped up our response to 300 to 400 beds using a combination of camps like Bulandra and other facilities. So as we stand now, by tomorrow and Sunday, we will have at our primary level 300 to 400 beds available. At our secondary and tertiary facilities, these are for a little minority of patients that may need hospital care, ICU care. At Couva, we have 254 beds waiting to be used. At Cora, we have 100 beds. We have repurposed Augustus Long. You will have 50 beds. And in Arima, we have 90 beds, giving us a total capacity at a secondary and tertiary level of 494 beds. We are also reprogramming work at Point Fortin Hospital, and I will have those figures for you by tomorrow. So in terms of bed capacity, we are in a good position. However, that could amount to naught if these 19,852 persons behave irresponsibly. To support that bed and facility infrastructure, we need our HR infrastructure. We have brought on to our team Dr. Anthony Parkinson. He is an intensivist ICU specialist, formerly attached to Port of Spain General Hospital. He will be managing, under the direction of the Chief Medical Officer, to lessen his burden, the ICU capacity, the ICU protocols to treat with COVID-19 patients at CORA and at AREMA if necessary. We have also brought on and will be bringing on over the next couple of days as the need arises, but they are on standby, 100 house officers and 70 retired nurses. Many of these retirees have volunteered their services free, but some will be remunerated. We also have 29 retired nurses who will come on stream if and when required. For our healthcare workers, in addition to PPE, in addition to meals, in addition to TSTT giving them credits so they could keep in contact with their family, we have set up and will make it available to them from today a separate hotline for healthcare workers alone to deal with their issues. This hotline or helpline will not be for the general public, only for healthcare workers. An instruction was given today that as of today and over the weekend, all elective surgeries at our nation's hospitals will be put on hold and rescheduled to sometime in the future. So that is what we are doing. We are also ramping up our investigations, our protocols at our homes for the elderly. The elderly, as you know, make up one of those vulnerable populations. The protocols have already been developed, and we are working with the Ministry of Social Development and Family Services to protect our elderly populations who are in homes. These will involve protocols for sanitizing, wearing of PPE, and restriction of visitors. Because the healthy visitor who is asymptomatic could bring the virus into an elderly home. And that, if you look at what is happening in Spain, California, homes for the aged became the epicenters for outbreaks in many of those countries. Spain, one place in New York, and a couple places else. So those are what we have done. That is the update. We'll entertain your questions afterwards. And for now, I'll pass you back to Minister Cox.
Thank you very much, Mr. Minister Dayal Singh. At this time, the Honorable Stuart Young will give us an outline on the new public health regulations with regards to COVID-19.
Thank you very much, Minister Cox, Cabinet colleague, Minister Dayal Singh, Minister of Health, and Chief Medical Officer, Dr. Parasaram. Good morning to the media and the wider viewing and listening public of Trinidad and Tobago. You would have heard the Honorable Prime Minister announce yesterday a very carefully thought out next step in the government's approach to dealing with COVID-19. And that was his announcement that we are putting in place stay-at-home measures. I repeat, it is stay-at-home measures that are going to be in place from midnight on Sunday, so effectively start on the 30th of March until the 15th of April. So the first point I'd like to make is these are stay-at-home measures from the 30th of March to the 15th of April in the first instance. These measures are being put in place, and as with all of our decisions thus far, are being driven by the advice from our medical experts. You all would continue to see what is taking place around the world with respect to other jurisdictions. And what we're trying to do, and fortunately we've been doing thus far, is learning from mistakes and adopting what we see based on our medical expert advice as the best practices to protect the population of Trinidad and Tobago as best as we can from this pandemic virus. The point I'd like to make before I get into what we are deeming under the regulations that will be published and disseminated shortly after we finish this press conference is that it is not business as usual. I found it somewhat interesting but not surprising with the number of calls and messages that we received by persons thinking they should be deemed essential services. So I'd like to start at the outset by saying our decisions are driven with the advice of our medical experts in an attempt to contain the social contact that is taking place so we can try to beat the curve, as it is called, in a response to COVID-19. The second point I'd like to make is even when I list these essential businesses, with each essential business that we list, we are asking the various businesses, and we put it in the regulations that will be published, that you only deploy essential workers, and those workers who are essential to operations and cannot stay at home. So it is not because we call you an essential business that you should be running business as usual and having all of your employees out. It is only the essential employees for the essential businesses that should be out. The next point is, as the Prime Minister announced yesterday, at all times, groceries, banks, and pharmacies will continue to be operational. Supermarkets, groceries, convenience stores, as I'll get into in a short while, even our corner shops, once they are selling and providing food and pharmaceutical items to the public. That will continue. This, of course, will have the full force of the law. Additionally, we are going to put in place a mechanism, as per the Cabinet-appointed directions, that applications can be made, and this is not an invitation, but I'm just telling you there's an exemption as exists now currently with the borders and the previous one, to the Minister of Health, who will consult with the Minister of National Security and the Prime Minister in determining whether we should take off of the essential business list or add to. But I'm saying right now at the outset, there is no intention by the government at this stage, unless it is absolutely justified and our medical experts give us the go-ahead, for us to be adding to the essential list. So, the other issue before I get to the essential list of businesses is we have taken a decision yesterday as a cabinet, and it will be implemented, that all public transport and motor vehicles shall be going forward limited to 50% capacity. So that is all licensed motor vehicles or maxi taxis or PTSC buses and or motor cars that provide transportation as taxis. We are going forward on the basis of the medical advice given to us. The Minister of Health, after a cabinet decision, is saying that only 50% of these vehicles should be used. Understand that people carrying on during their daily activities, there is a level of exposure, so we're trying to reduce that as best as we can. The Minister of Works and Transport made it very clear that public suasion should be used. So do not let maxi taxi drivers or taxi drivers force persons to occupy more than 50% of these vehicles. So for the period that I've identified, the 30th of March to the 15th of April, the following shall be the essential businesses. We're saying that all persons should not be at any workplace unless they are deemed to be an essential business, and all workers shall work from home unless you're in essential business, and then even then only the essential workers. No one shall gather in public places where persons exceed 10 persons, except, of course, for these essential businesses. You will allow more than 10 persons, for example, in the groceries, in the pharmacies, and this type of thing, maintaining the social distancing that we're now all familiar with. The essential businesses are the operations of the judiciary in the magistrates and supreme high courts of judicature, the industrial court, and legal services, sittings of the House of Parliament, meetings of Cabinet or any Cabinet committee, sittings of the Tobago House of Assembly and meetings of the Assembly or any committee thereof, primary emergency and protective services, state and private emergency ambulance services, the Trinidad and Tobago Police Service, Trinidad and Tobago Defense Force, Trinidad and Tobago Fire Services, Immigration Services, Strategic Services Agency or SSA, basic services concerning the provision of health, hospital, water, electricity, fire, sanitation, civil aviation, telecommunications, and the funeral homes. Workers who support the operation, inspection, and maintenance of essential public work facilities, including water and sewer main breaks, fleet maintenance personnel, traffic signal maintenance, and other emergent issues. Or prisons, rehabilitation centers, immigration detention centers, and other places of detention. Or children's homes, community residences, rehabilitation centers, places for the care of the differently able, socially displaced, the elderly, and geriatric homes. Private security firms, estate constables, and special reserve police. Social services such as social workers, including non-governmental organizations that work with the socially disadvantaged and vulnerable. Support to ensure the effective removal, storage, disposal of residential and commercial solid waste and hazardous waste. Or financial services, and of course we list the financial services and the support services. So the banking, businesses, other institutions defined under the Financial Institutions Act, including the unit trust. We've included cooperative societies, remittance houses, and then all of the support services that are necessary. Persons providing services, for example, to keep the ATM machines going, the security services, the cash in transit services, and that will be listed as you will see in the regulations. Service providers who provide services that are necessary for maintaining, this is important, service providers who provide services that are necessary to maintaining the safety, sanitation, and essential operations of our personal residences, including plumbers, electricians, exterminators, and most importantly, only live-in domestic workers. Immediately, you should understand why we do not want to put our domestic workers, who are very hard-working, at risk over this period, which really is a short period to the 15th of April, by having them leave their families and their homes to travel, expose themselves, potentially expose their employers and their families, and then the same way back. So only live-in domestic workers at this stage are considered to be essential. Convenience stores, corner shops, discount stores. Discount stores, of course, are meant to cover places like PriceSmart and those type of bulk stores that supply food and pharmaceutical items. Supermarkets, grocery stores, pharmacies, and hardwares. Of course, as I pause on this, it allows all of us, the citizens who need to go out and get supplies to these places, to do so when the stay-at-home order is in effect. But of course, we're imploring upon you, no congregating, no gathering. Go straight to the stores, get what you need, and come back. We have taken a decision to close all government services apart from ministries and municipal corporations. Ministries and municipal corporations, of course, with the proviso that applies to everything, will now go through and decide which are the essential services for every ministry, and persons who cannot work from home, of course, exercising caution, as will be determined by the ministers and their permanent secretaries in every ministry and in our municipal corporations. The Inland Revenue Division, Treasury, Central Bank, Customs and Excise will remain open. We have put in here a category called transportation and logistics services. Of course, this is necessary to get goods, cargo coming in via air, via sea, to the relevant groceries, pharmacies, stores that are providing food and the pharmaceutical services to the rest of us. So, of course, it will cover the employees. You will see it when you get the regulation. We've included port operations, the truck drivers. An important exception, we are only allowing automotive repair and maintenance facilities who are providing direct support to essential businesses. So it is not that every garage can remain open. There is obviously a health reason for this. You again don't want persons congregating. But we are allowing the repair services and maintenance facility services for those who apply their direct services to the essential businesses. Manufacturers and distributors of food, beverages, pharmaceuticals, including the packaging and bottling of these items, postal and shipping workers, including private companies, repair and maintenance of aircraft, marine vessels, and the equipment and infrastructure that enables operations that encompass the movement of cargo and passengers. We've included, of course, aviation, aviation and airport operations, services connected with loading and unloading and repair of ships, with the storage and delivery of goods at or from ports. So this would capture the movement of the goods off of the ports to the various storage facilities, including warehouses, so not limited only to warehouses. The public transportation of water taxis and ferries, motor vehicles and buses, subject to what we said before, operating at a 50% capacity. We have included workers supporting groceries, pharmacies, and other retail that sell food and beverage products. Restaurants can have takeaway and delivery operations, no in-restaurant dining. And we are pleading with persons, do not congregate at these establishments. Restaurants will establish their numbers so people can call ahead and just get their takeout via drive-through or just picking up curbside, as well as their delivery services. The media. This one took a bit of consultation with my colleagues.
It was a no-brainer.
The media, which includes workers supporting newspapers, radio, television, and online media services, and in particular the Minister of Communication, her ministry and her workers are captured under this category, in addition to what we've said about ministries. Services related to food production, packaging, agriculture, fisheries, animal care and attention. So of course this allows our food production, including the rearing of cattle, poultry, and all associated services, the production of the necessary feed, the veterinary services, or zoo to continue feeding animals, those at the university that have animals to be fed. It allows all of them to continue with their business. Energy services, oil and gas industries. A lot of questions were asked, so again, yes, energy services or oil and gas industries are captured and are considered to be essential business, with the proviso, only essential workers. It does not mean business as usual and that everybody should be coming out. We're asking everybody to continue to operate safely, but understanding that health is driving these decisions, and only use the bare minimum of essential workers you need to continue your production and your operations safely. Hotels, guest houses, or eco-lodges licensed under the Tourism Development Act. The Seismic Research Unit at the University of the West Indies. A specific category. We are not including construction sites and construction workers. We are not including construction sites and construction workers. Remember, this is intended to end on the 15th of April. However, we have given a specific exemption for construction workers and services engaged in the construction of healthcare facilities to capture what Minister Dayal Singh was saying. We need those workers to continue under the Ministry of Health's directions to finish the facilities they're working on. There's another category of workers who are necessary to keep furnaces and kilns operating safely in manufacturing operations that are not captured as essential operations in Sub-Regulation 2, who are needed to keep these furnaces and kilns operating for safety reasons. There are some industries that they cannot just flick a switch and shut down their kilns and their furnaces. We're not saying outside of the manufacturing of food and beverages that you can continue business as usual. But we're not saying that you have to shut down your kilns, because we understand. So it will only be the workers associated with the safe continuation of keeping these kilns at a standalone and not continuing to produce your products. Any trade, and then we provide that the Minister of Health, after consultation with the Minister of National Security and the Prime Minister, can amend this list. It is not an invitation, and we will be really abiding over the next couple weeks to the 15th of April with this list as has been declared. And what we say is that these essential businesses that we've identified, we're only it's applicable to those workers and officers who are essential to the operations of these identified categories and cannot practically work from home. Persons have been asking if we will be issuing passes. At the end of the day, it is going to be the police, with the assistance and support of the defense force, who are going to be policing this, who are going to be ensuring that we abide by this. Everybody who is out there come midnight on Sunday, please walk with your identification. You will have to justify to any law enforcement officer, with the support of the Trinidad and Tobago Defense Force, who pulls you over and asks where you're going, you will have to fall into one of these categories that we've identified as an essential business. So employers may want to issue letters of authorization to their essential workers who will be coming and going. Us, the rest of the public, when we're going to groceries and pharmacies or hardware in the off instance, we will have to tell the police officers and the defense force officers who are supporting where it is we're going, and please let us go and get back as quickly as we can without the congregating, and bearing in mind at all times the social distancing and personal hygiene that we have drilled into our heads over the past few weeks. I like to end by just saying, it's really a plea. The government is doing and has done all that it can reasonably do, including a lot more than certain other developed countries around the world did in the fight against COVID. We are only going to get through this and keep that curve down if everybody abides by what the advice we're giving is. We've taken this step. This is not a state of emergency. It is not a lockdown, no matter how those outside there may want to describe it as such. These are stay-at-home orders and stay-at-home provisions given to us on the advice of the medical experts. Thank you very much.
Thank you very much, Minister Young.
1 second, Minister Cox. Sorry. The regulation will be finalized and published through our Ministry of Communication, the Ministry of Health, and it will be widely circulated within the next hour. Thank you.
Thank you very much, Minister Young. And Minister Young, there's a prison officer online wanted to know. He said he didn't hear you say prisons.
Yes, prisons is very much part of it. The prisons, rehabilitation centers, immigration detention center, and other places of detention.
Thank you. Ladies and gentlemen, we open the floor for a few questions. Wait, please. Just take the mic, please. Thanks.
Good day, Julian Neves from Newsday. Minister Young, since you recently completed, I will start with you. What will happen to someone if the police stops them and they cannot prove, well, okay, they're essential service and they're not going, to the grocery or whatever? What will happen to them?
All right. At the end of the day, the instructions to the police, and I'll be having the specific discussions with them, is they need to enforce this law. So in the first instance, they will use their persuasive powers. And that's why I'm really pleading with everybody to just act responsibly. Because the ultimate penalty will be you can be liable to a fine of up to $50,000 or 6 months imprisonment if you disobey the police instructions. There is going to be a certain level of flexibility, but you really have to prove to the police officer stopping you, to his or her reasonable judgment, that you're either one of these working in these essential businesses, or that you're going to the grocery pharmacy or something like a hardware, or to pick up food. Understand these things are being done to protect us and our health.
All right, and my next question, Minister Dayal Singh mentioned that they'll be adding another category when you're giving out the figures and so forth. I just want to clarify, you're giving the figures of samples. Those samples would include the retesting of people as well, too?
Yeah.
I guess that would be for Dr. Parasram.
Yeah, so these samples would include any sample that has been submitted to Trinidad Public Health Lab for onward transmission to CAFA.
So my question is, would it be possible to add a line saying, well, these are samples, but these are the number of people tested?
Yeah, I suppose as the days go by we can, but we would have tested persons more than once in certain instances. As it relates to discharge protocols as well, we have to test more than once. So one particular individual might be tested 3 or 4 times as well. So we can look at adding it, but the utility of it has to be borne in mind before we do so.
And last question for me for now. You had mentioned in a previous press conference giving us some demographic data, just ages and would you be able to provide that now? Or?
Yeah, so my team, I just spoke to them again to get an update on the figures, and they are actually actively working on putting together the full list. Of course, as you know, we would have gotten additional cases overnight as well. So we have to get basically what we want to give to the population is basically saying age, distribution across age, across sex, if they are related to any comorbidities. So we're pulling all of that, but they have to come from the various patient notes. So it is a little bit laborious, especially the part about comorbidities, because oftentimes when we get the result sheets back, they don't indicate those pieces of information. And I think that is what is required to basically say how our epidemic is looking, if it's looking similar to other epidemics across the world, or if we are seeing unique trends. So it is a time-consuming process, which my epidemiology unit has been looking at from day one, and there is an ongoing process, but we will give an update in the near future.
Okay, I have a question online. A lot of questions pertaining to exercise. Persons would like to know if they can exercise in the community or if they can come out and exercise.
I too have been bombarded with that question. People, as difficult as it is, and we understand the mental health and the wellness perspective, the answer is no at this stage, because we really do not want people outside their home. That is why it's being called a stay-at-home. There are many ways you can exercise within your home, right there in your compound, in your yard, etc. So we're asking, understand, as we keep trying to emphasize, this virus is spread by contact. So you can be exercising, touch something, and that is where the contact takes place. You wipe your brow or something because you're sweating, and it can start as quickly as that and spread very quickly and very easily. It is a sacrifice that we all have to make until the 15th of April. This is our opportunity to continue trying to beat the curve. When you look around the world, the ones who created the exceptions are the ones who right now have the runaway spread of the virus. So unfortunately, at this stage, we're asking you to exercise within the confines of your homes.
Hi, good. Is on? Hi, good day. Rashad Khan, Guardian Media. Either the Minister or the CMO would be best to answer this question. No, I understand fully well patient confidentiality. The second death that we had also had pre-existing conditions. Would you be willing to say if there was any commonalities in the pre-existing conditions?
Well, I just want to say that based on the epidemics in other parts of the world, we have found, and recently in Italy, that the majority of deaths still continue to be in persons over 60. Now, these two persons would have been older than that. They would have met that definition to start with. So it falls within that. And again, adding any comorbidity to it increases your risk. So I think they would have been in similar sort of demographic conditions, both of them, but I don't want to say any more in terms of their particular status.
Sure. Now, when it comes to contact tracing, I know you all spoke about it a little bit before, but with regards to the first death as well as the personality, where have you all reached in tracing all the contacts that they would have had?
Okay, let me just step in here. Please do not refer to any patient with any identifier. We don't treat people based on personality. Could I just ask the media? All patients are entitled to patient confidentiality. We will not be answering any question which implies, directs, or infers that we are speaking about any individual. I made that abundantly clear at the last press conference that the day anyone under my watch or myself even hints at any patient identifier, the Prime Minister will not have time to fire me because I will resign. So I am asking the media to resist the temptation to put into the public domain any possible identifier which could even remotely point to any patient. Please, people are entitled to the first principle of patient confidentiality. And the CMO will not answer any question under my watch which can indicate even remotely which patient we are speaking about. If you want to ask a general question, that is fine. And that is why I said earlier, we have one patient who has been released and discharged, and I will not say it's patient number 5, patient number 6, and patient number 7. We are guided by a higher moral principle.
Okay, I'll rephrase the question then, Minister, but before I do, it is my understanding that the person that you told me not to identify waived their right to confidentiality when they came public. Now, I'm rephrasing the question. So, CMO, is the ministry 100% satisfied that all contacts have been traced so far with all the cases that we've had?
Right. So we have traced primary and secondary contacts and tertiary contacts for all the cases so far. There's something that I think Dr. Hines would have touched on when he did his presentation about contact tracing, called a hidden contact, right? So generally speaking, when someone moves about, they know who their primary contacts are, which is very close family and friends. Secondary contacts are people that would be in contact with that primary group, and tertiary contacts will be people who are in contact with that secondary group. There are people along the way. For instance, and let me use an example. Somebody has symptoms and they go to a supermarket, right? They come into contact with a trolley. They have symptoms, they're coughing and sneezing. The particles go onto the trolley handle, and somebody else comes right after them. We don't know who that person is, and uses the same trolley, maybe a few minutes later. That's what we call hidden contacts in terms of tracing, and that's where the risk arises to the population. And we should behave as if the person before us used the trolley was actually contaminated. And when we start to use that premise, we will actually do social distancing, do hand washing, do sanitization, don't touch our face. Because I am sure if you know that the person who used the trolley before you was contaminated, you will behave differently. So the hidden contacts in an epidemiological sense are our greatest risk of spread. However, if people are ill or people are showing signs of any sort and they stay home, the hidden contacts are reduced significantly. There shouldn't be any hidden contacts. All you will have is primary contacts and at most secondary contacts. So that's why we are taking all the measures that we are taking.
Okay, so you are satisfied that all the primary contacts and those that
primary, secondary, and to some extent tertiary contacts that are known to us are being well self-isolated and well followed.
Okay.
If I
We have a question here.
Sorry, Minister Cox.
We have a question here for Dr. Parasuram. There have been reports of faulty test kits coming out of China, rapid test kits donated and sold. What assurances are being put in place to ensure the test kits donated and bought to be used in Trinidad and Tobago have the required sensitivity and accuracy and won't give false negative results?
Sure. So there are two broad categories of testing that is used worldwide for COVID right now. There are the rapid test kits, which Minister Cox spoke about, and there's the polymerase chain reaction test, which is a PCR test. So the one we are using in Trinidad is the latter, which is a PCR test that actually tests the level of antigen, the virus particles. It gives you a level, and it is very sensitive and specific. It's almost 98 to 99% specific. So it will give you very little false positives and very little false negatives. The only agency in Trinidad that is testing for using that test right now is CARPHA. As Minister would have alluded to, the Ministry of Health is trying to build capacity in different areas to do that test on our own. So that is the only test we're using right now. The false negatives that we were getting is from the rapid test. So Trinidad and Tobago at this point is not using rapid tests. PAHO does not recommend the use of rapid tests either at this point. So we are not using rapid tests. We are only using the polymerase chain reaction, which has a very good sensitivity and specificity.
Mr. Young?
Thank you very much, Minister Cox. in the categories of essential businesses, we have also included caregivers for the elderly and those who require it. Right? That's one of the questions we're being asked. So we have also included the caregivers for the elderly and those who require it for medical conditions. Also, under the energy, oil and gas, it does include fuel stations, gas stations as we call them in Trinidad and Tobago. Gas stations are included. Thank you, Minister Cox.
Okay, and just a follow-on. Someone was asking about funeral homes and about churches with regards to funerals and weddings.
All right. The funeral homes have been included. The funeral homes, what we're asking is that persons, the same measure, you don't congregate in more than 10, and that's specifically set out here. As I had mentioned, I think in a previous media conference, there are very, very innovative ways of sharing these intimate moments. So someone had told me about the use of live streaming from the funeral. It's not ideal, but we're not in ideal times and circumstances, and that, of course, allows a much wider number of persons to participate. The same way we're having done right now with a lot of services, be there Christian services and other services. There's streaming going on and people following on that way. But funeral homes are included with the limitation of 10 persons.
Minister Young, this is another question to you from TV6. And this question says, can you find out if any of these actions planned by the government legally allows the Trinidad and Tobago Defense Force to arrest anyone?
I was very careful in my use of language, and I said the Trinidad and Tobago Defense Force would be playing a supporting role to the Trinidad and Tobago Police Service. But my advice to you is don't test the Trinidad and Tobago Defense Force, because they've been given some instructions to protect us, the population of Trinidad and Tobago. So I really wouldn't recommend getting in an argument with our defense force or law enforcement officers who are doing their duty, which is really to protect all of us.
Yes, Julian Neves again. Minister Young, well, you're speaking specifically about funeral homes. What is the policy regarding people who want to have a funeral service or a wedding service, as Minister Cox had asked?
It is the same as has been applicable. It is the same, no congregating for more than 10, because we recognize that depending on person's religious suasion, it may not include a funeral home. So we've said previously, for example, if you have to go to cremate a body, keep it to 10 persons, please.
My question for Dr. Parasram, what is the protocol when dealing with the bodies of the deceased patients?
So I don't want to go into too much detail. We just had 2 deaths. There are 2 families that would have been affected. So the WHO protocol is the protocol that we are using in Trinidad. We have actually had consultation with a lot of the interreligious groups, all the heads. We're trying to meet with as many as possible to see how the WHO protocol can be tailored to our needs. So it is a guideline. WHO gives us a guideline. The principle of it is to limit contact with the deceased person's body in any form or fashion, thereby reducing spread of the disease further. So our guideline is complete. We're having consultation with the religious groups just to let them know what the guideline is basically, so that they can inform their different members as to how things will go with these particular patients. But the guideline speaks broadly to allowing for cremation and burial. However, in terms of cremation, we're looking at a crematorium only. In terms of burial, we're going to the grave site only. So there's no home visits, there's no church visits, there's no visits other than from the funeral agency to the grave or the funeral agency to the crematorium. I don't want to go into further details.
Let me just supplement that, because that's an excellent question, and I thank you and congratulate you for that. The Undertakers Association wrote me as Minister of Health about 3 weeks ago, and we set up a meeting with them and the CEO of North Central RHA, Mr. Davlin Thomas. They met. I got the minutes of that meeting. And in those minutes was spelled out what the funeral homes will be doing to protect funeral home workers. and how the three major religions, the Christians, the Hindus who cremate more, cremate exclusively, how the Muslims do it with burial, Christians do a mixture of cremation and burials. So they came up with a list, a little protocol of what they will be doing, and that will be supplemented with what the Chief Medical Officer said, the WHO guidelines with the IRO. So that was considered, and I want to thank you for that question, very important one.
Okay, there's a question here. In the list of essential businesses, does agriculture include farmers like my dad and brother? They run a roadside stall selling their produce.
The answer is yes. From what Minister Cox has just described, you fall not only under food production, which includes our farmers and our fishermen, but also in the retailing of the food product. Minister Cox, if I may be permitted, I'm also being asked about the diplomatic corps. The answer is the diplomatic corps will be allowed some level of flexibility, so they will be included, but only the essential staff, right? Everybody is being asked to scale back. I can't emphasize that enough. Just because you're captured as an essential business, it is not for you to send out your full complement of workers. This is really to get us through with the bare minimum of movement in Trinidad and Tobago until April 15th. We're also being asked about general insurance clients who have to renew their motor car insurance. This is something that has arisen. It is something that unfortunately requires, I believe, the law to be adjusted. I heard on one of the television stations this morning, one of the largest insurance companies, I believe it was Guardian, saying that they were going to grant a moratorium on payments, etc. It wouldn't apply for the application of this. So right now we've provided for insurance companies under the financial institutions. But again, try and keep it to a bare minimum.
Okay,
yes,
we have a question here.
Sorry. As I said a short while ago, during this period of stay-at-home, everyone should walk with your identification. So your driver's permit, your ID card at a bare minimum. And also, if you fall within the essential services, walk with your work identification as well to produce for the Trinidad and Tobago Police Service or the supporting role of the Trinidad and Tobago Defense Force. Also, what I've suggested is companies issue letters to their various workers. Understand we will be very vigilant, and persons are to be sent back home if they didn't fall into these categories. Thank you. Sorry, Minister Cox.
TTT?
TTT Limited. With regard to the homeless, how are the authorities planning on treating with that? And furniture stores, this is a call to our newsroom courts. They want to know whether or not they should send essential workers out.
Sorry, I didn't hear the second question. So just hold on the second question. The Minister of Health was helping me with the first question. The Minister of Social Development and Family Services has had a conversation with both the Minister of Health and myself. We are starting with the socially displaced by first having a move-along policy to try and encourage them to go into the shelters because they're safer in the shelters. Apart from that, we are going to explore the use of the law, if necessary, with the Ministry of Health, working along with the Ministry of National Security, if we have to physically remove them as per the law. I'm sorry, what's the second question?
Second question is with regard to a call to the newsroom. They're just wondering, furniture stores, courts, whether or not they have to send essential workers out and limit themselves as well.
Courts and furniture stores do not fall under essential services. Courts and furniture stores don't fall under essential services. Basically, the categories we've listed here are for food supplies, right? Food and beverage caught by food, as well as pharmaceuticals and hardwares. Restaurants with curbside pickup and call-in and delivery services. Not the clothes stores, not... I'm finding it hard to keep a straight face. Cloth, upholstery, I mean, and no. So the quartz stores and stuff, they don't fall in.
Thank you. I have a question for Dr. Parasuram. About 2 persons wanted to know if COVID could be spread from the deceased.
I think the simple answer is yes. And that's why WHO has put out such stringent measures to deal with a deceased person. The level of spread at this time doesn't seem to be as high as Ebola, for instance, which of course is a much higher level of pathogen as a level 4 containment. But it's similar, it's somewhere in between H1N1, around those likes. But it can be spread, and therefore we're taking the necessary precautions.
Thank you to Minister Young. Can the Minister give an update on the Arouca police officers who were quarantined? Are they all being tested, and how has this impacted security in the area?
Thank you very much, Minister Cox. The normal protocols and applicable protocols that the Minister of Health and the CMO and the other medical experts have been telling us about over the past few days, past couple of weeks with respect to testing apply. So all of the officers were quite rightly quarantined by the Commissioner of Police and he consulted with me. The police station is being sanitized to have it back up and operational as soon as possible. But no one should feel that this has played any part in a lessening of the effectiveness of the police service in that area, because immediately what was done is the further deployment of resources in and around the area to service the area were implemented. So the police officers who are quarantined will be tested if they present symptoms in accordance with the WHO protocols that are currently guiding our testing.
I know that this was answered before, but it seems like a few persons still asking how many ventilators do we have in Trinidad and Tobago, and were the 2 patients who died placed on ventilators?
So the answer is yes. I gave a detailed breakdown of ventilators at least twice. So the short answer is yes, we have enough ventilators. But it's not only do you have ventilators, do you have the protocols to treat with patients who need to go on ventilators. And in my opening statements, that's why I said Dr. Anthony Parkinson, who is an intensivist, he will be managing those persons on ventilators. Because you could have ventilators, but if you don't have the expertise to manage it, then you have a gap. Whether those 2 persons were on ventilators, I think the Chief Medical Officer could possibly answer that. But ladies and gentlemen, because I know we're coming to an end, I just want to tell Trinidad and Tobago, this weekend that is upon us, this long weekend, as I said, is the critical time. This is the tipping point. Today, Friday, the 27th of March, how the caseload reflects itself Friday, Saturday, Sunday, and Monday, because this is 7 to 8 days after those 19,852 persons would have come into the country. This is when most of their symptoms will start to show up. And if they behave responsibly, I will not have to use those 1,000 bed capacity I have built. I don't want to use it. I wish I didn't have to use it. I don't want to use the almost 200 extra healthcare professionals we have on standby. I don't want to use it. But if those persons do not self-isolate, do not self-quarantine, we may have to use it, and more. And that's when the curve isn't flattened. When you have an explosion in cases, an exponential rise in cases, which exceeds your hospital capacity. So far, so good. But this weekend is the tipping point. This weekend. So let me just end by saying, to Trinidad and Tobago, we are prepared. However, this is not a joke. This is not a drill. This is not a practiced run. This is the real thing this weekend. And if we all behave responsibly, I could possibly report to you in a week's time that the curve was flattened because we behaved responsibly.
Minister Young, there's a question about NLCB. What about their operations?
Thank you very much, Minister Cox. The Minister of Finance asked me that early this morning as well. The answer is NLCB operations will be suspended until the 15th of April. It's certainly not an essential service. Another one that I was just asked about here, Minister Cox, if I may be permitted, is the Chambers of Commerce. The Chambers of Commerce, well, a Chamber of Commerce is asking whether they're considered essential services. The answer is no. A Chamber of Commerce can operate remotely, provide the numbers to your membership. If they have questions to you, with technology today, they can reach out to their various chambers, set up your protocols, and you can then deal with the concerns of your members. There is no need, and that's a good point to make now, from our perspective, the government perspective. We have taken these decisions for stay-at-home purposes, exactly as the Minister of Health has just pleaded with us. So all of the businesses that have not been listed in this regulation that will be published in the next hour or so, please be responsible. Work from home if you can. If not, it is to stay at home until the 15th of April. This is our only fighting chance to have the curve flattened. Thank you all very much.
Thank you.
Colleagues.
I have a question, and Minister Dayal Singh, you spoke about someone being discharged. There's a question here about what happens next. What is the protocol involved? Because some persons are afraid.
That's an excellent question, and we discussed that just this morning with the Chief Medical Officer and Dr. Erica Wheeler from PAHO. Once a patient is discharged, and the discharge criteria are as follows. They must be asymptomatic for about 7 days and get 2 negative tests 24 hours apart. But then we are also asking them as another layer to self-isolate for a further 7 days. So they can go home, but stay at home for a further 7 days. That's an excellent question, and I think that should bring some comfort to the population.
Thank you very much. And ladies and gentlemen, final statement from the Honorable Stuart Young.
Thank you very much, Minister Cox. Just to jump in there, because of course this is going to be one of the last settings until we go into your virtual studio. Private security firms have obviously been kept in there to assist us in the state's law enforcement apparatus in performing the duty of helping secure. So we are asking that the use of private security firms continue. They are what we consider to be an essential business. And people of Trinidad and Tobago, these measures have been implemented for your own protection and safety from a health perspective. And I fully encourage you all to please abide by the further stay-at-home order, which kicks in from Sunday midnight until April 15th. Thank you very much, Minister Cox and Minister Dayal Singh.
Okay, thank you. Before you go, here is a reminder about the National Day of Prayer. This Sunday, March 29, 2020. Do remember that it is a virtual event, and what this means is that we are asking you to tune in via your television, radio, and the internet. And so far, TTT, TV6, CNC3, Synergy, IETV will be carrying it live. Power 102, 91.9, 104.1 will be also carrying this prayer live. And if you're unable to do so via radio or television, just go online to TTT Live. So just to recap, it is a National Day of Prayer on Sunday the 29th with the Honorable Prime Minister. It starts at 8:30 a.m. via radio, TV, or internet feed in the comfort of your homes as we fellowship and pray together to keep Trinidad and Tobago safe in this time of COVID-19. Thank you.